When the ACL is a structure right here, so it goes from the back of the femur to the front of the tibia, and it's in a plane like this. This is kind of a not so great model because there's two bundles to the ACL. They're not distinct like two separate bundles that you see, but there are definitely two bundles. Basically, when a person tears their ACL in a non-contact method or non-contact mechanism, they typically land. It's the way they land. It comes down to how they land. And the punchline of this whole story is teach women how to land softer and land with their knees more bent and their hips less extended. Less extension in the knee, less extension in the hip, softer landing. Land like a cat is what we're trying to teach women how to do, and less knock-kneed. That's ultimately what we're trying to do, and make the hamstring stronger. So what this whole meeting came up with was plyometrics, strengthen the hamstrings, and pay attention to how you jump and land. More importantly, landing. So when you land awkwardly and your knee is in valgus, which is knock-kneed, and the tibia rotates, it tends to rotate like that. So the tibia is rotating this way internally on the femur. And the knee is in valgus, which means it's in a knock-knee position. That puts, and the more extended the knee is, the more stress there is on the anterior cruciate ligament, so that it tends to just literally do that, pulls away like that, and when that happens, down goes the athlete, there goes the ACL. We commonly see injuries to the back of the tibia, back here, to the meniscus on either side actually, and bruises to the end of the tibia and to the end of the femur, because when the tibia, it literally rotates, translates, and bangs into the femur. So it's a contusion, a bone bruise. So that's the general mechanism. So if you can prevent that, if you can prevent a patient or an athlete from landing in that knock-knee position and a little bit more knee extension, we think that will help prevent ACL injury.